Hi, my name is Joe Belvedere. I'm 60 years old. I've been a patient of Dr. Cochran's for about 5 years now. I was first diagnosed with prostate cancer when I was 50 years old through routine examinations. I went in to my doctor at the time, and he convinced me that one of the best things to do, and was being covered by insurance at that time, was biopsy. After some discussion, I decided that would be fine, and we'd try the biopsy. It's the most definitive as far as getting answers as to the health of your prostate. So I went in for my biopsy. After about 2 weeks, I heard back from him. He told me that 3 of the 12 sections that they did take came back cancerous, and to come into his office and we'd discuss it. About 2 days later, I went in, we sat down with him, and his recommendation was to have my prostate removed. There were other options at the time. Of course, they were all traditionally known. And I told him I would most likely get a second opinion, and he, of course, agreed with that. Through good fortune and contacts, I was able to reach a doctor that was difficult to get to in Baylor, Dallas, and he sat down with me and my wife, and he said he'd just like to do what he called aggressive surveillance, was basically keep a close eye on it. So every 3 months I would go in and have a prostate exam and a PSA test. He eventually stretched that to every 6 months because nothing really changed and everything was fine. I had no medications that I was taking. I was having no adverse effects. I wouldn't ever have known that I had any prostate cancer if I hadn't done the biopsy. In any case, after about 3 years with that doctor, he wanted to do a second biopsy, so I agreed. Nothing had changed, and we continued on every 6 months with the checkups. A few years later, he wanted to do a third biopsy, and I was having my doubts at that point in time. So I started looking around for alternative methods and had heard about a couple of things, and HIFU being one of them. But at the time, they were not doing HIFU in the United States. It was being done just about everywhere else in the world, but not here. So I let a little time go by. I checked on it again, maybe about a year later. I held off on the third biopsy. In any case, I found out that there was a doctor here in Dallas just through internet search, and I called. It was Dr. Cochran, and I spoke with his administrative nurse, Sharon. She was fantastic, and they set up an appointment. I went in and consulted with him, and I found out, in fact, I was a candidate for HIFU. He said, just tell me when you want to do the procedure. I said, okay. About 2 years went by, and I finally decided to do the procedure. It was an outpatient. I was in that morning. I think I was out for about 3.5 hours. Everything went beautifully. I came out, and Dr. Cochran was standing by my bed. He said, you're cancer-free. I said, fantastic. That's what we were aiming at. And I've been great ever since. The procedure, of course, went exactly as he had explained it would. I would definitely recommend a HIFU to anybody as an alternative that it's good for after a consultation with your doctor. Dr. Cochran was outstanding. His staff was the absolute very best. And once again, if it's an alternative for your situation, it would be the one that I would take. I was only out of work by choice for 2 weeks, but I only needed to be out of work for about 1 week. If you're a regular office job, you really wouldn't have to miss a whole lot, maybe a couple of days. I travel for a living. I'm in the air all the time, so it was something I chose to do, is stay home for a little bit and just get fully recovered.